Hello, this video will provide an overview of the Assess and Treat section of the new 3.5 OC ePCR run form. As a preface, it may be helpful to have the technical summary PDF open when viewing this video, as much of what we will be showing is described in the technical summary. Okay, so here we are focused on the Assess and Treat section. Let's start at the top with the pediatric assessment triangle. These changes were actually made to the existing 3.4 OC ePCR back in 2022, but we mention it here as a reminder. There are 4 questions here, with the final one visible only when an abnormal finding is documented above. And the whole section is controlled by a visibility rule based on patient age. So if the patient is an adult, field crews will not see this panel. Next, we have Chief Complaint and Impression panel. To start, we have some new pertinent negatives for date and time of symptom onset, approximate, and unable to complete. Remember that these pertinent negatives can be layered on top of the real value documentation. Like so. We've also added a few required elements to this panel, starting with the chief complaint anatomic location and organ system. Both of these are required on any patient contact, just like the chief complaint itself. Also, with similar documentation requirements, are other associated symptoms and initial patient acuity. All 4 of these elements are national and state requirements. Finally, the last change to this panel is in the barriers to patient care element. A few new values have been added. We've put them right at the top of the list. A couple values for suspected alcohol and drug use, and 1 for emotional distress. And that's it for this panel. On to the Treat and Response panel. In the grid for primary assessment, there are a few small changes. This is the grid for all of our vital sign elements. The GCS elements now have values that include pediatric verbiage, cardiac rhythm and EKG have new values for STEMI and non-STEMI septal ischemia. And that's it for primary vitals. The next grid is for secondary assessment. This is the grid for all of our exam elements. We have some different values in eye exam. The value for fixed/dilated was removed, and 2 different values, dilated and pinpoint, have been added. The old combined chest and lung exam element has been removed and replaced by 2 separate elements, 1 for chest and 1 for lungs. And that's it for the secondary assessment grid. Next, we have a new grid for protocols used. There are 2 elements in this grid, 1 for protocol used and 1 for the protocol age category. These elements are national and state requirements, but in addition to acceptable not value use, they may also be left blank and are not currently validated. Continuing to move down, we have medical devices. There are no changes here. Next is the medications grid. There are no changes there. And in procedures, we have a new pertinent negative in the procedure element. Order criteria not met. And an IV/IO location has added values for wrist, left, and right. And that's it for the procedure grid. Next, we have advanced airway confirmations. The only change to this grid is the addition of chest rise as a value for airway device placement confirmed method. That is it for advanced airway. And finally, there are no changes to the ventilator settings grids. Now on to the injury panel. There's only one question here. Documentation of this element is required on all patients, including those without an injury-related complaint or impression. The question here is also not specific to a traumatic injury. The determination of that will be documented later. Any and all injuries qualify here as yes and lead to further examination, at which point the injury may or may not meet the requirements of trauma protocols. I'll click yes so that the validation rules on injury detail are highlighted as pertinent. However, there are no changes to this panel, nor are there any changes to cardiac arrest, and either yes value will reveal the cardiac arrest detail panel. There are a few changes to this panel. In cardiac arrest etiology, the value for exsanguination has been clarified to be non-traumatic. Next, several elements have been removed and replaced with other elements. The elements that are being removed are CPR care provided prior to EMS arrival, who provided CPR prior to EMS arrival, and finally, who used AED prior to EMS arrival. Those three elements have been replaced by who first initiated CPR, who first applied the AED, and who first defibrillated the patient. Moving down, we have a new field for the types of CPR provided. This is a multi-select field where you'll document all of the values pertinent for your case. And the final modification on this panel is the new cardiac arrest disposition element, which is required and validated. The stroke panel is next. There are no changes to this panel with the 3.5 standard, nor are there any changes to the STEMI panel. Finally, we have the narrative panel. A couple changes here to present some elements that are commonly documented toward the end of the incident report. One is the crew member completing this report. The other is the grid for crew members. Having it here will allow your crews to make any final selections or changes without having to open up the run info section again. And that concludes this overview of the Assess and Treat section and its 10 component panels. Please let us know if you have any questions. Thank you.